yeah.
That's fine. Uh-oh. Hey, Warren.
Hey.
There we go. Can you hear me?
Yes, we can hear you now. You okay today?
I cannot complain. We're getting
Oh.
some rain and it's not 112.
I know.
Oh,
I know. I got tickled. I looked at the weather for later on in the week, next week, and it says the 70s. And I was like, for the high.
oh, we're entering into fall. It means we're going into our fall.
I know that's what that means. I mean, we came really quickly, didn't we?
Well, and keep in mind, it could get really hot again real quick.
Real quick, real quick, real quick, real quick.
Let's see.
Hey, babe.
Betty is working on some things right quick.
Cool.
Warren.
I'm here.
That's, Betty's working on a couple of things,
I thought you were in-
and that's not Betty. The picture is not Betty.
I thought you were in- Oops.
We had 49 to register.
Oh, perfect. I'm going to step away for just a minute. I'll be in the area though. So I can
Okay.
I want to see if I can shut down my Outlook.
Oh, yeah.
I don't know if I can do that though.
So Doris, I think you just say that you're going to share screen when you're ready, and I'll grant permission if I have to.
I thought I was going to let you do the clicking.
Oh, I can click.
Yeah.
I can click.
You can do the clicking because that'll be easier for me.
Okay.
Like, you just keep the screen. I don't need
Okay. How are you, Warren?
I am wonderful. And you?
Good. I'm great. Do you want to click your own slides or do you want me to click them for you?
Why don't I have you, if you're okay, why don't we just keep this consistent and I'll let you click them. I'll
Okay.
just give you.
I could do that. You just give me direction and just say, okay, next slide, and we'll do it.
I will do.
Okay. Well, thank you for doing this for us.
Oh, our
Oh,
pleasure. Thank you
yes.
for including
Of
both
course.
Doris and myself.
Yeah.
Yes. We are excited.
Yeah, we are really excited.
Betty, just let us know when
You got it.
you're ready for us to start.
You got it. We've got 3 attendees and 4 panelists, and we're not ready yet. But I appreciate y'all joining ahead of time. I'm paranoid.
Don't be.
Well, what's happening in North Texas?
Rain thing.
Pouring rain.
Is that right?
Yes.
Oh my gosh.
Did it rain all last night? You guys know?
It seemed to. I had a ton in my water, in my rain gauge.
Yeah. That's what I think. It poured down. Lightning, thunder, the whole 9 yards. Betty, whose picture did you put here?
Mine?
Well, no, I don't think this is you.
Oh, that's my colleague.
I don't think that.
That's my buddy Kent. He is so cute, and I work with him. And this is his account. We're all sharing his account for the webinars. So, but he's darling.
Okay. Ken is the one who sent us the email, correct?
Yes, ma'am. Yes.
Okay, fantastic. Yes.
Well, hey, on a good note, our reported COVID cases seem to be leveling off below 150.
Yes. Well, that's good news.
Very good news.
But no one should get too anxious too soon.
Oh, don't worry. We have a major holiday coming up, and that
I
always
know.
causes a problem.
Always. We've gone, how many? 2 holidays? Yes.
We had Memorial Day, we had July 4th.
Yeah, this will be the 3rd.
This will be the 3rd one.
Yes. Fantastic.
And the good news is this one tends to be a little less about everybody getting out than the other 2.
The others are let me out for the summer.
Yep.
This one is get ready for the fall and winter.
Right. Well, and Memorial Day, remember, that was, oh, we can take a deep breath. We're through it. We've gone through 3 months. We're in good shape. Let's just, let's go back to normal.
Yes. So.
Well, Gretchen, I show at start time, but if you want to wait a few more minutes. We've got 6 attendees, and they'll come as we get started. But it's up to you if you want to wait a little bit more or if you want to launch.
Let's go ahead and get started and be respectful of everyone's time. Okay.
You bet.
All right. Hello, everyone. Welcome to the North Texas MGMA first virtual meeting. My name is Gretchen Collins, and I am the president of the 2020 MGMA for North Texas. I'm excited that you're here to hear this information about survival tactics. I would like to acknowledge the rest of the North Texas MGMA board. We have Nicole Kreitz, who is our vice president. We have Sarah Thompson, who is our past president. We have Demetrius McDowell, our treasurer. Alex Hines is our secretary. Matthew Caldwell is our communications chairperson. Thank you so much for being here. We're excited about our discussion today. We're going to talk about employee safety, patient safety, marketing, compliance, regulatory, and best practices. I'm excited about this. And so, as you know, 2020 has been a difficult year. And here we are 9 months into the year, and look at where we are. So we want to be able to give you some tools, some resources to be able to help yourself out during this time of COVID-19. I'm pretty sure you've read over the bios for our speakers today, but I want to give you a quick synopsis of both of them. First, we have Doris DK, a healthcare attorney practicing in the areas of health law and healthcare compliance from law firm Friedman and Feiger in Dallas, Texas. Serving as an executive level advisor in the home health industry for many years, Doris has extensive experience interpreting complex policies and educating corporate leadership on compliance requirements. Doris states she helps doctors, dentists, nurses, and health staff members with healthcare employment and healthcare business law matters. This includes physician and nurse practitioner contracts. Doris also is an owner of a specialty practice in Collin County. So Doris will bring with us experience from the legal aspect as well as the practical standpoint. Warren White, Senior Vice President, Chief Marketing Officer for Adaptus Health. Warren leads all marketing, branding, and internal communications for Adaptus Health and its portfolio of brands, including First Choice Emergency Room and joint venture partners Dignity Health, UC Health, Texas Health Resources, Ochsner Health, and City Hospital. Warren will also share his expertise with us regarding building brands, increasing revenue, and growing affinity. 15 years ago, Warren founded and created 9Y Communications, a new breed of marketing and advertising agency designed to drive revenue growth for startup and middle market companies. We're excited that both of our speakers are here to help us tackle some of these issues related to COVID-19 and medical practices. We will first start with Doris, then Warren, and we will have question and answer. So at this point, let's start with Doris. Doris?
Hi, everyone. I appreciate you giving me the opportunity to speak, Gretchen, and to share my expertise with you guys. As we all know, COVID-19 has wreaked havoc on our healthcare businesses and just everybody in general. After WHO declared COVID-19 a pandemic, and after 19.9 million people worldwide have been affected, we know that the shelter in place and the outbreaks continue to cluster around the country, causing many businesses to shelter in place or just shut down completely, while many medical offices have remained open and have been inundated with patients seeking assistance or who have had patients had to reopen and just have challenges. As you know, because of COVID-19, we've had a lot of safety issues. Now, my first concern with safety is making sure that your healthcare organization has the right people to partner with you. Do you have a lawyer or compliance individual there helping you wrestle with the many difficult safety regulations? Because since COVID has hit in February or March of 2019, the rules and regulations have been changing at lightning speed. So many healthcare providers and healthcare organizations have been struggling, trying to figure out where to turn to. One of the best places to turn to would be the CDC, OSHA, and CMS. Now, when we talk next slide. Now, when we talk about CMS, now CMS has the Emergency Preparedness and Disease, the Emergency Preparedness Rule. Now, that rule happened after the Ebola outbreak in 2014. The Ebola outbreak after the 2014 occurrence had a lot of providers wrestling with having enough PPE, other protective equipment, just trying to organize the right appropriate care for patients and their staff. So in 2016, as a result of the Ebola virus, the emergency preparedness rules became promulgated, and the rules actually were updated after COVID-19 in 2019. The purpose of the emergency preparedness rule is to establish a national emergency preparedness requirements to ensure adequate planning for both natural and man-made disasters. So the natural disasters would be like the Ebola virus, a hurricane, or COVID-19. Now, each federal, state, tribunal, and regional, local, or local regional governmental office will have the emergency preparedness requirement, and all 17 provider types have to abide by the emergency preparedness rule. There are 4 core components to the emergency preparedness rules. That's an emergency plan, a risk assessment, a communication plan, policies and procedures based on the emergency plan and communication plan, and training and testing programs, including drills and tabletop exercises to test the emergency preparedness plan. Yes, I think you're right. All 4 elements of the emergency preparedness plan must be reviewed at least annually. Providers and suppliers are encouraged to review and update their emergency preparedness plan to address COVID-19 and any other hazards that might have become apparent since the last review. To that extent, they rely upon contractors or vendors to manage elements of their emergency preparedness plan. So you should be interacting with your providers and vendors to make sure that your plan incorporates them as well. The Justice Department will be doing surveys on provider types on your emergency preparedness plan. So following standard protocol is completely important. So if you look at this, this is an example of an emergency preparedness plan that CMS puts on their website. If you look, it says clinics, rehabilitation, and therapy. Each type of healthcare organization will have a different type of requirement and a different type of plan. So you have to go on CMS's website, look at the type of organization that you have, and make sure you're abiding by the rules and regulations that are pertinent to you. Additionally, CMS has a pandemic influenza operation and response plan that I always tell providers to look at, so you have an idea about what type of things CMS is specifically asking you to abide by. So remember, if you're taking Medicaid or Medicare, you have to abide by the emergency preparedness plan in order to keep receiving funding. Our next slide. Our next important rule and regulation you got to follow is the Occupational Safety and Health Administration rules, which is OSHA. Now, federal law entitles all your employees to a safe workplace. As the employer, you must keep the workplace free of health and safety hazards. Your employees have a right to speak up about hazards without fear of retaliation. Employees at a medical clinic have the following rights. They have a right to receive workplace safety and health training, a right to receive required safety equipment such as gloves or harnesses, and be protected from toxic chemicals or any type of toxic work environment. If you look at the next slide, you will see that since COVID-19 has happened, almost 500,000 employees have had to leave their workplace because of having an unsafe place. Now, if this happens, if you see this chart, this means that employees have been complaining. An investigator has been there. They've probably issued fines for those workplaces, and then employees leave. Now, when I'm talking about OSHA, OSHA is laws regulated for employees or employers, but if there's an OSHA violation, you might even get a private lawsuit against you by your employees if they feel like they're unsafe as well. So it's super important that you're not just applying these rules for private regulators who might, or public regulators who might come after you, but your private employees might say this is unsafe. In fact, Walmart was sued by its employees for wrongful death because of COVID. Okay, the next slide. If you look at the graph I have here, OSHA designates on their website for healthcare workers the types of risks you will experience. So someone who's in the back office doing administrative duties is at a lower risk, obviously, because they don't have that interaction with patients. Probably the front office who first gets in contact with the patient has a medium risk, and the higher risk is the person who's intubating, the person who's taking the medical hazards, the person who's collecting specimens has the highest risk. So it's important to look at this chart and determining what type of policies and procedures you're going to have in place in your organization, depending on the person that, depending on the employee. Next slide. So until more is known about COVID-19, OSHA recommends using a combination of their standard precautions, their contact precautions, their airborne precautions, and they have various rules and regulations, including the bloodborne pathogen, Rule 29 CFR, Personal Protective Equipment Rule 29 CFR 1910, and a respiratory protection rule also on their website that you can access. The first type of control that OSHA tells you to have is an engineering control. And an engineering control involves isolating employees from work-related hazards. In workplaces, there are appropriate types of controls that you can do, such as putting plexiglass up so that the front office is literally not coming in contact with patients. It's increasing high efficiency air filters, increasing ventilation in the room so that COVID is less of a risk. There's also administrative types of controls that you can create for your offices. Those administration types of controls include telling people they can work from home, changing sick policies so less people are coming into the office, changing shifts if that's feasible to your office space. So having some people work the afternoon shift, a night shift, a morning shift, just so there are less people working it into your office. So that's really policies and procedures that you're taking in place to change the type of behavior that's happening in your office. Now, OSHA says engineering and administrative controls are the best types of controls that you can have for your offices because they literally stop the contact immediately. The next type of control they have is obviously the PPE. Now, PPE is important, but the administrative and the engineering controls are far more important than the PPP. And as you know, back in February, March, and April, there wasn't enough PPE for a lot of physician offices. And as we move into fall, that's something to think about. Now, yes, PPE is important, but I'd rather you do the other important steps because we might have the same issues that we had in the past. But yes, make sure you have gloves and eyeglasses and the right mask, depending on the type of employee you have. Obviously, someone who's going to be dealing with COVID patients has to have the right type of equipment. So moving to the CDC's guidelines, well, before I actually move into the CDC's guidelines, I want to also say OSHA has a back to work workplace safety policy that you can access on their website. It's like a 70-page document, so you can also look at that. So finally, it's important that you look at the CDC's guidelines. And the CDC has guidelines for safety that they want you to initiate into your offices. You have to understand and execute current infection protection control, which obviously includes changing your healthcare practitioners on the use of PPE and hand washing and controlling the visitors that come in. And the CDC also wants you to monitor people. The CDC emphasizes having enough screenings and triaging people. I'll say that I went to my OB and they didn't even let me come into the building without getting a temperature check. The CDC recommends you do something like that so that people don't come into the building who are exhibiting clear signs of sickness. That's a great way to prevent people from catching the disease. Okay, I'm going to briefly talk about some compliance and telehealth considerations. As you know, because of COVID-19, there have been a lot of relaxation on telehealth requirements. The CMS and HHS is not coming down as harsh on the use of the channels for the telehealth equipment. So you can use the Zoom, and you can use other channels, but you can't use like Facebook or WhatsApp and everything like that, but you can use Zoom and Skype. Those are safe. However, it's important that you check with your payers, because each payer is going to have its own telehealth requirements. However, with people working from home, you're going to have clear issues with telehealth. I want to say that one of my providers was having his staff work from home, and one of the staff members was an administrator, and she wasn't answering some of the phones. So a patient got upset because she'd been calling several times about an issue, and then she reported my client to the medical board. So yes, have people work from home, but also have the right procedures in your office to make sure that everything in your office is getting addressed. Finally, I want to talk about marketing. Now, marketing is super important during this COVID season. As we know, just because it's COVID doesn't mean our rules and regulations surrounding marketing have changed. One, I want to just quickly mention some few highlights about marketing. You need to make sure any marketing agreement is in writing. It's over 1 year. The marketing agreement should be flat fee to avoid percentage splits on marketing contracts. You should avoid language of inducing or rewarding marketers for any individual clinical services. You should avoid gifts, but if you are going to provide gifts, have them be for a nominal amount, or the gift should be for food. I know a lot of doctors' offices do food, but even that has to be nominal. No cash of any kind. Services should clearly be articulated in your marketing agreements. And finally, if you're going to include logo and any types of advertising, make sure that you're clearing that with an attorney, that it doesn't fall into some type of infringement of anybody's patent or trademark rights. Okay, Warren, I'm going to switch it to you to talk about marketing in more detail.
Great job, Doris. Thank you for the handoff and the setup there on the marketing piece. First, Gretchen and the board, I would like to thank you for the opportunity to come and speak today and share a little bit more about some of the insights that we're seeing as things have changed, or especially consumer behavior with our friend COVID showing up back in March. With that, if we can move to my slides real quick, Betty. So real quickly, I want to kind of to level set things. We're going to talk a little bit about what happens with consumer behavior when we have one of these major societal disruptions happen. We've had several since we got into the 2000s. And those really cause consumers to kind of stop and reassess and change behavior. And one thing that we got to keep in mind when you talk about a consumer, humans are herd animals. From the day you're born, everybody's trying to put you on a schedule, and that schedule becomes comfortable. And when you disrupt that schedule, what happens? People get uncomfortable. You're asking them to do new things, and that's something they don't really like to do. So Betty, are we ready with the slides?
I'm sorry, I'm having some issues. If you could just go, I'll catch up with you.
Okay, that's perfect. I will just go. How about that? Let's step back and let's take a look at a few of the most recent societal changes that we've had. Let's go back, to 2001 when the 9/11 incidents happened. Major disruption across the United States, but it also rippled into other countries and around the world. Those changes sent everybody home for a while, right? And when they came back, everything was about safety and security because the consumer didn't feel comfortable anymore. They didn't feel that life was safe. And it was kind of a bunker mentality. But one of the things that came out of that is when they came back is consumers began to expect to see more police presence. They started to see more video surveillance. They started, being comfortable as they could be and waiting in line to get into events. All changes that came from the disruption created by that event. The next big one was in 2008 when we went through the Great Recession. During that time frame, there was a huge change. And it rippled across the world again. Probably one of the biggest things that happened coming out of that recession was at the same time that recession happened, just months prior, the iPhone came out. And that was a new technology that once it got into the consumer's hands, began to accelerate. What happened from there was you started to see the internet in my hand, my ability to respond at a moment's notice, to tell the world if I was not treated well, to tell the world if I didn't feel like, I got my fair shake. In addition to that, that created the beginnings of the on-demand society, as we call it in marketing. And the on-demand society is, I expect that a service is going to be delivered to me 24/7, 365, and I'm going to be able to get a response whenever I want. Now, kind of a downstream negative piece to that was now consumer expectation went up. And you got what became the term became rock star treatment. And everybody expects rock star treatment. And if they don't get it, they're going to tell the world they didn't get it. And so that was a major thing that created an acceleration of innovation in the marketplace and a change in behavior on the consumer side. So let's go, but if we can go back one slide, is that possible? Okay, then we had the coronavirus show up. And we had a little precursor to this, and I would say almost a test run when Ebola hit. When Ebola hit, the American consumer was fearful but not terrified until it showed up in Dallas, Texas at Presbyterian Hospital. And it was very interesting. I happen to have two personal friends that were there and were working. They were providing care to that individual. And as we discussed this, everybody's concern was that Ebola had hit the marketplace, it had hit Presbyterian, and more than likely, Presbyterian was done. That no one was ever going to go back there because Ebola was in there. And they saw, their admits went down, their ER visits went to nothing. But if you come back and look at it today, it's a thriving, critical piece of the healthcare ecosystem in DFW. And you're going to see this same kind of effect with COVID when COVID came in, where everybody did what? They went home, they stopped going to the doctor because they were scared. And innovation hit. Telehealth, which was supposed to be, should have been going wild and crazy with consumers because it is the ultimate in 24/7 delivery of healthcare. You would have thought before that it would have gone crazy, but it hadn't. Now let's go to the next slide. Then, because what happens when these societal events hit is it ripples across everything, and especially in healthcare. I mean, the regulatory landscape has changed dramatically, and it's changing daily, right, Doris? Patient experience has changed. Now they're afraid to come in, so they want things that make them safe or feel they're safer. Our clinical practice had to change. Supply and inventory changed, and our staffing changed, all to compensate for that. That's what happens when this big disruption happens and acceleration and innovation accelerates. So let's go to the next slide. Then here I put these up. This is usage of telehealth before at the beginning and as of a couple of weeks ago, what happened. And you can see that trial has just flew through the roof, and now it's starting to level back off. That's that innovation coming in. That's the consumer starting to get comfortable. That's us being on Zoom today, having our call. So let's go to the next slide. Because you're going to ask, what does that mean? Well, that means there's been a big paradigm shift, and it's going to shift really quick. Before we talked about patient-centered care. Now we're going to be talking about person-centered care, because now it's about the person. It's not just come in for a diagnosis. It's how do I get you healthy today, but how do I make sure to navigate you through the system? And how do I take care of you? And how do I take care of your family that comes in with you, or any caregivers that come in with you? This is a major shift that we all have to be, aware of, but it creates some major opportunities for us. Now, that's from the consumer standpoint. Let's talk about your friend. Let's go back one more, because there's one last piece I want to talk about. From the healthcare ecosystem, we're going from a point of care view of the world to a clinically integrated world. And this really started several years ago. I mean, maybe 10 years ago, really, if you look at it. It's just now starting to cycle up. And it's that innovation, I think you're going to see that move forward faster, because with so many people that opted out of going anywhere in healthcare. And now they're starting to come back, and we've got to make that clinical integration work and work with everybody that's navigating patients to us. So let's go to the next slide. Let's talk specifically about what this person-centered care changes and how it's going to help you in building business and business development. During this time frame, in the last 4 months, everybody in healthcare has looked at how do I remove the points of friction for the person that's seeking my care? How to make it easier to get to me? How do I get it to them in ways that they've never had before? And how do I make it as safe as possible? These are all great things and things for you to talk about, because all of you are instituting those things. And that's what you should be talking about over the next 3 to 4 months, is all the things you're doing to keep them safe. And when you talk about it to the people that are coming to you, is don't talk about the feature. Don't talk about telehealth. Talk about the ability to stay in your home and for me to be able to put you in touch with a clinical caregiver. Talk about your patient portals, well, all your information is. And you can see it in a minute. Everything's there, can be taken care of. It's making it easier on the consumer. All great things for you to talk about. And highlight the human interaction and safety part of it. Because each different demographic out there views this differently. You got your digital natives that are like, yeah, telehealth ain't a problem, I got it. Portals, got it. Don't want to give you more information than I have to, got it. Then you get to an older demographic and they're like, man, I'm not real comfortable with this iPhone. I'm not real comfortable with doing a video chat. What do we have to do here? All those things, very positive, and you got to reinforce them. And the beauty of what's happened with regulation and the regulations that were there before that kind of open up for us is now we can go talk to them about things we probably wouldn't have talked to them about before, because we didn't have a lot to talk about. You couldn't email a patient unless you had a reason to talk to them. And a reason would be defined in the CDC guidelines as that you were going to tell them about a new service, you were going to tell them about their, an upcoming appointment they had, something like that. Now you have an opportunity to be able to go out and talk to them and tell them all the great things you've done to make it easier for them to come and access the care they have gotten from you, and let them know that, spin that message. And you can now do that with text messaging. You can do it with email marketing, all things that we kind of stayed away from or we're a little worried about. Now we need to adopt those and think about how we use those and put those into our toolkit, and also using social media to be able to tell this story of safety and better care that we're delivering. So that, from a consumer, the person standpoint, are the things we should think about. Well, this also applies, let's go to the next slide, to everybody that's already navigating patients to you. You want to remove those points of friction as well, and you want to sell them on how you've removed these points of friction for the patient so that it's easier for them to get to you and for you to hand them off to them if they need it. And the best way to do this that we found at Adeptus is, you've got to create peer-to-peer relationships. You may have a marketing person that's going out and spending time talking to people that are navigating patients your way, or trying to talk to other people to navigate patients your way. They may be talking to members of an ACO. They may be talking to other members of the healthcare ecosystem around where they are. The key is get them in, make them hand off nurse to nurse, and make them hand off physician to physician. Because once you do that, you create a relationship that is comfortable, and then each group knows, oh, I know that physician practices like I do. I know I can call them. All those things begin to come into play, and that makes it easier and more comfortable for them to work with you. Now, the last piece to that is, now that we're talking about all these things that we're doing to make it easier for the customer to come to us, to remove those points of friction, and to remove those points of friction between a navigator and myself, is use your data to tell the story. Talk about the things that you've done. Talk about how that, we've been able to increase our telehealth visits by X. And we're providing it where, these people are coming back to us X number of times. Talk about the number of people that we are navigating to other points in the healthcare system. Use those data points, because that's the thing that really sells. People don't really want to hear you say, wow, this is great. You did a great job. Thanks for, sending that person over. Be able to go in there and tell them, hey, we know we sent 4 people your way. How did that go? Is there anything we can do to make that better? How do we remove that friction? Those are the types of conversations, so that you've got other natural points of navigation, navigating more patients to you because you made it easier than anybody else. Does that make sense? Hope so. All right, well, let's move on to the next slide, because now we're going to get into probably the most important thing today, today to talk about. Healthcare is like no other industry. Compliance has got to be marketing's friend, and marketing has to be walking in lockstep with the compliance department. Because as everything changes, and as these regulations are changing literally overnight, you got to have somebody that's in contact with them to make sure you don't get yourself in trouble. Best thing you can do, we did in our team, was we identified who owns risk in our organization, and then we created a relationship with them. And in yours, it may be that you have a direct link straight into the legal and compliance department. Could be that you don't even have a legal and compliance department, and you need to be talking to outside counsel like Doris, so that you can make sure that you're covering yourself. Or the other piece could be make marketing. That's what we did. We made marketing the conduit to the compliance team and created that relationship so that we were working together. And one of the things everybody will say is compliance, compliance, compliance. All they want to do is say no. I found that to be just the opposite. Compliance's job is to manage risk. Marketing's job is to work with compliance to understand the risk profile and reduce that risk as much as possible, but also be able to sell. So I can't emphasize enough how important that is to create that relationship. And I would tell you that after this, Doris and myself are going to be open for you guys to call at any time and ask questions. We'll be there to help answer those questions and give you guidance. And so, number one, stay with it and create that relationship just to keep everybody safe, including your patients. So the last thing in closing I'd like to do, if we can move on, is just kind of some key things that we think about as marketers. And that is, always talk to whoever you're talking to in a business development setting in their terms. In healthcare, we tend to talk a really strange language, especially when it comes to the consumer. I mean, it's a mix of Greek and Latin that they don't always understand. It's protocols and processes. Try and take it down to their level and make it easier for them to understand words they can use. The second is find those natural intersections where consumers are, people are running into your care, and talk to them, be it social, be it email, be it text messaging. Find those, be it on your telehealth calls. Use those times to sell at the end. Make sure they're comfortable. Make sure they got great service. Ask them to, tell their friends. And last but not least, always strive to create a meaningful, a memorable, and an engaging experience with your brand so that they'll keep coming back. That's what I like to refer to as connecting the dots between your brand and the customer. And when you do that, you always win. With that, I'm done and open to questions.
Fantastic. Thank you, Warren and Doris, for wonderful conversation about how can we survive during COVID-19. At this point in time, Doris and Warren are open for questions. One of the questions that we've already been asked is, can you get a copy of the slides? Doris and Warren.
Of course you can.
Yes, so we will be able to provide the slides. Doris has also provided her email address, and Warren, your email address is on your end of your slide presentation.
Into my
correct?
slides, yes, ma'am.
Yes, and so that's fantastic. I have a question that I wanted to ask. How do you convince a person in your geriatric population to use the new wave of telehealth or texting? How do you convince them that that is safe and that's a good way for them to be able to communicate to their physicians, and also be able to keep them saying that their information will be safe, because they're concerned about HIPAA, I'm pretty sure.
Yeah,
Yeah.
I mean, Warren,
Doris, take it, Doris, and then I'll drop on top of it.
well, I think that it's important that you have a conversation with the patient and maybe the patient's family and talk to them about the privacy things that you're putting in place to keep them safe and keep their information safe, right? Now, a lot of payers, like I mentioned in my PowerPoint, do not allow you to use Zoom. So you have to talk to your payer first, see what type of portal they allow, and then talk to your patient and say, look, I'm using the portal that Blue Cross allows, or I'm using the portal that Aetna allows, and they have regulated that this is safe. We are also going to put these XYZ securities in place to make sure your stuff isn't dispersed. And then also, it's important that you're having conversations with patients. Where are they even doing the Zoom and the telehealth meetings with you? I mean, you can be in your home, locked up, or in your office, making sure that, no one else is around. But if the patient is in Starbucks, or the patient is with their, people they don't want to know stuff, and those people are into the conversation, then, your privacy is breached anyways. So it's important that you're having a conversation about what you're going to do, and then conversation with the patient. What are you going to do, patient, to keep your stuff safe? Where are you going to be seated in your home, or seated in your house, or where you're going, to make sure that you're not in an area where you could be potentially breaching your own safety?
Okay.
And from a how do you talk to them perspective, the real key here is that you want to walk them through the process as best you can beforehand to make it easy, and kind of make sure that you address any issues they have before they log on.
Mm-hmm.
You're still going to run into some reticence on some consumer side, that they're just not comfortable with it. Don't be afraid to recommend that they get another family member to help get them online and get them into the call. Those are all things that are very helpful, that can make people feel more comfortable. Because what I have found, and I'm going to tell you this specifically from my father, who is 86 years old, and when I told him he needed to do a telehealth visit versus going in, he got very worried. And I sat down with him and walked him through it, and he's like, "This is the greatest thing in the world. Why didn't I do this before?" And I was like, "Dad, there's a lot of people like that." It's about trying to make it comfortable for them and helping them figure out things to make it easier, more comfortable for themselves, like bringing in, a younger or someone that's comfortable in the family to set it up for them.
Mm-hmm. during this time, we also have issues budgetary. And with that being said, people don't have the money that they have had previously. You know, money has always been tight. And so now to be able to say that perhaps do I need to hire additional staff to be able to massage patients into this comfort zone for them to be able to do this? What are your thoughts on that?
I don't think you need additional money to articulate to your patient that this is important to do. I think that I think the budgetary concerns are very, very valid issues, but I think that the provider and the owners can sit down, and you could even come up with like a slide that you can show some of your older patients. Like, first, you're going to save money by not coming to my office. You're going to save time by not coming to my office. You just can do it in a way that doesn't necessarily require spending more money. I just feel like just speaking to them in a way that they understand, and coming up with like a PowerPoint or a presentation that, you know, Warren could put together if he's, you know, hired for your organization. I don't think it's going to necessarily be a lot more money that's additional staff. You just use a contractor like Warren, and he can come up with like a nice PowerPoint or slideshow or poster that you can provide your patients and kind of explain the high level points as to why they need to stay home.
Mm-hmm. Okay.
Yeah, I would add to that. I would add to that, you know, depending on, you know, what type of practice you have, your volume could be way down or it could be way up. If it's way down, start repurposing some of your staff to do some of these things for you. You know, find a younger staff member that's technologically advanced and say, hey, can you help us out with this? Can you help us figure out, you know, can you spend some time on the phone with patients that are doing telehealth visits? Can you spend some more time doing this or that? You know, I really don't think this is a matter of adding more people. This is just working with what you've got and using that excess capacity.
And to back on what Warren is saying, you know, when you're asking staff to do extra stuff, that might lead to them getting frustrated. But it's important that you tell the staff that, you know, we're all in this together. I mean, people are not oblivious to the fact that we're in an economic recession right now. Okay, there are a lot of people losing their jobs. I will tell you, February, March, April, I had a lot of nurse practitioners calling me, oh my gosh, I just lost my job. Oh my gosh, they're cutting our salaries. So there were some small physician practices who kept their practitioners, cut salaries a little bit, but they had some people do extra non-clinical roles just to have people be useful. I mean, if that means that you're on the phone and, you know, you're a nurse practitioner, you would never be on the phone. Well, now you're going to do it because everybody wants to keep their job, and it's not what anybody wants to hear, but it's the reality of the situation. And people, I think, because they know the gravity of what's happening, I think people are more they're more amenable to letting that happen.
Well, and I also think, you know, that's a great point, Doris. I think the other thing you've got here is this is part of the new shift. I mean, healthcare as a whole is moving towards lower reimbursement, trying to drop costs, which means more of us are going to have to do more things and get kind of out of our comfort zone to be able to deliver the service and the care that we need to be delivering. So, you know, and again, I share the same view Doris does. Our clinical staff has been awesome in jumping up and saying, what do I need to do to help our patients and help our company to survive? Those are all good things. And those are the types of employees you want to keep because they're going to deliver the right type of care and service.
That's true. So the key word is repurpose.
Repurpose.
Mm-hmm. Repurpose would be repurpose tasks and responsibilities for those staff that are already there. Because I'm pretty sure when clinics went to the point where they weren't seeing patients at all, what do you do with the staff? And Doris, from your experience as an owner of a clinic, how was that for you?
It's what you mentioned. We had a lot of staff go home and work telehealth. And that's like a lot of administrative stuff at home instead of having to come in the office. So that saved them money because some of our staff were in Dallas, so they're not driving to the office anymore. And we had a lot of nurse practitioners pick up the phone, like pick up the phone and help with some of the administrative tasks. And in the beginning, they had a problem with it. But once they realized that their friends were losing their jobs, they were happy to do it. They were
Oh.
very, very happy to do it. And they were doing extra tasks like getting coffee for people because they were just like, oh my gosh, this friend lost her job and this friend lost her job. And I'm just happy. Because we actually had to have people use their PTO in the beginning. Before the PPP money came out, we had people use their PTO for a few weeks. And then we reduced salaries a little, not too much. I think we reduced salaries by 10% just before we got that money because we were really, really, really tight. But the staff understood once they saw what was happening. Yeah, I mean, we didn't lay anybody off. You know, we didn't lay anybody off. Everybody pulled their weight. And if they didn't want to be there anymore because of, you know, their kids now having to be home, those people might have, you know, departed, but they departed to stay home. They didn't depart for another job because they knew there weren't that many there. So we just really tried to work with everybody and be frank about everything. I think if you're honest with your staff to what's going on, what the constraints are, and you just keep a team spirit, we are all in this together. We're going to survive it together. We want to keep everybody's job. I think that people are more willing to figure it out. People are more willing to work. People are more willing to help out. So, yeah.
Okay. I have a question from Tom. It says, the San Antonio MGMA had an open forum membership meeting via Zoom last Thursday, and they discussed issues affecting the medical practices. A new twist with school starting is the staff member parent having the dual roles they did not have in regular school year. What are your recommendations to address this issue?
That is the issue that we're having right now in our office. And it's, I mean, I think everybody, even outside of healthcare, because a lot of healthcare is women, and the nurses, the MAs are all women, and they're the ones who keep those roles. I think if they're a non-clinical staff member, if they can work from home, let them work from home. If they, you can answer phones from home, you can scan from home, you can do a lot from home. And if you can repurpose those people from working from home, you're going to have a lot more success and a lot more employee retention. I think you can probably do a lot of telehealth from home too. Telehealth is kind of, everybody thinks telehealth is the Band-Aid that's going to solve everything. The problem with telehealth is you don't get reimbursed at the same rates as in-person meetings. So some of the providers, they have to be there. Some of your nurse practitioners have to be there so that you can get a higher reimbursement rate. So for your staff members who can work from home, if they're administrative staff, let them work from home. Let them do tasks from home or have half days. Like, you're going to see these patients in the morning, and then can you do this on your time at home? You can pick up phones on the answering service from home. You can, schedule the medications at Walmart from home. You can do so much from home. It's really being creative and meeting with your staff. How can we accomplish our goals together? But I don't think there's a perfect answer to that, because if 80% of healthcare is women, you're going to have an issue.
That's true. Warren, is there anything that you would like to add to that?
No, I think Doris covered that perfectly. I mean, if I was going to add anything to that, it would be, continue to, I'm going to go back to an earlier point she made, which is, be upfront, be transparent, share information with your employees and team. And I think what you'll find is the culture of your practice will benefit from that and will grow in ways you can't even imagine. And you're going to find some rock stars that you didn't know you had. But, open, transparent communication, key here.
Warren made a good point, because I think that staff members are more loyal to employers who are transparent, and they're more loyal and more willing to figure it out and weather the storm with you when you're willing to figure it out with them too. Because we've had staff members bring their kids into the office, like randomly. I couldn't find any childcare. I had to leave my kid, in the office. And we were like, oh my goodness, you're going to have to go home because of COVID. We don't want to expose your child to potential any type of, issue. However, you know, just having a frank conversation with the employee and coming up with ways to massage and work around that and really trying to work with people, I think those are the people who try to stay because, you know, at least with like your MAs and things like that, those people are very transitional and they leave quickly. So you want to be, if you find a good person, just try to make it work. Be empathetic to your staff members because if they're getting the salary cut in the middle of this, they have all these other things on their plate. You gotta express a lot of empathy with these people and be a team player also.
And a key point I think to add on to that is great ideas come from all places. You don't have all the right answers. Put 2 or 3 brains on it. Now you got 6 or 8 and you come up with some new and innovative thinking. And this is what I think we have an opportunity to do and to really let those employees feel like they're providing more value to the company and they feel like they're contributing even more.
Mm-hmm. That's true. Through my years of experience, I've found out that being honest and open with staff, it's always proven to be very beneficial. So I find that to be very good. We have another question here that says, if you do have parents working from home while those employees without children have to work at the clinic, are there any potholes from a discrimination or fairness aspect?
Certainly on a fairness aspect. Obviously, you want to have the same policies across the board for everybody. You know, if, you know, to combat that, I think you might give some of those people who don't have kids some time off. Like, hey, maybe you, and, you know, I think OSHA mentioned like, you know, switching. So maybe you have these people work from home for these couple of weeks, and then these people work from home these couple of weeks, just so they also have an opportunity to have the same benefits as the other person. Because you don't want it to feel like only they get all these extra perks because they have the kids and, you know, they have all these issues. So we got to work around their schedule. You want to, you know, you do want to be fair, but I think that you can be flexible with your employees and speak to them and say, hey, you know, you haven't taken your PTO. Do you want to take some extra time off? Or how can we make you feel comfortable about this too by allowing you some extra time to work from home too? But, you know, I got to be honest, some jobs you cannot work from home. Like, you know, the doctor needs to come in, whether he has kids or does not have kids. He might say, I want to do telehealth. We got a bottom line. We got to reimburse at a certain rate. You got to come in. And that's like, if you have a nurse practitioner and a doctor, you have to say, whoa. We got to meet our numbers. And this is why. And that's a frank conversation with them. They might not like that, but nobody likes getting their salaries cut either. And that's what happens when you have people just doing telehealth. So those are conversations you might have with your staff too. Like an MA, it's not necessarily going to matter because that's not going to affect reimbursement. The doctor and the nurse practitioner are absolutely going to matter. So you might have a conversation with them and saying, hey, we can do some telehealth, but we can't do all telehealth because of this. And they'll understand that because now they're getting that.
It was said that, thank you for your recommendations. While I think we all try our best to be fair based on circumstances, HR is always a tough part of the job. And that is so true. Under normal circumstances, HR is probably the bulk of the job of any position of any industry. And so that's true. I have a question. We did a survey for North Texas MGMA, and we had a lot of our members to ask questions. And one of those questions had to do with SEO. And they wanted to explain that and how could they use that in this new world. Okay.
That's a broad term, but I'll try and cover some points on that. And SEO is it's probably the foundation of your marketing efforts now. You know, your website is the front door, the digital front door to your practice. I'm going to tell you that this is a highly specialized skill, and that you really need to get somebody to help you that knows what they're doing. And, you know, SEO as kind of a couple of different ways that SEO works. One is what we call organic, or what's going on your website. And then the other part, which is SEM, which is part of that, social search engine marketing is making sure that your local search ads are there for the consumer and easy for them to find. I would tell you that right now, the cost for search ads are going up, and that's just because more and more people are searching. But that is a key point. You want to make sure that you're spending a lot of time and working on your budget for your local search ads. That would be your, if somebody searches for, PCP near me, you want to make sure you're showing up in those rankings. But I'm going to give you some key points here that are extremely helpful. One is focus on your online reviews. Whatever you do, that's probably your most important thing that you can actually do from your staff's perspective is talk to consumers or your patients as they leave and ask them to do a review, good or bad, because they're the best ones to tell people how well you're doing. And we know that somewhere over 70% of consumers use online reviews as part of their discovery of where they're going to go, especially if they have to seek out a new point of care. So those are key things for you, I think your team can do to help that, because as your review numbers increase and you go from, let's say you're at a 4, you go to a 4.7, you're going to start bumping up in the search engine rankings. So you should focus on those things and then find somebody, find an SEO group to help you make sure and maximize what you're doing from a search engine perspective. And that's probably one of those ones who, if somebody's got a specific question about that, please reach out to me. I know a number of great people, very knowledgeable, that will do a great job of working with you, and they're all focused on making sure that you're delivering results. It's not just you're putting ads out there, but you actually got people clicking on them because you're using the right search terms and you're in the right places. So because that's such a specialized piece, I would say, please reach out to me, call me, and let me talk to you a little bit about that and your unique and special situation.
Now, Warren, you mentioned reviews. I think that a healthcare practice having monitoring the reviews that they have on their business is super important. Whether you're the owner or you have somebody designated, needs to be looking at the reviews, because let me tell you, some patients write some reviews that are just, it's not even about the care. It's about how somebody spoke to them. One patient wrote a review that they couldn't get their narcotic medicine. Like they were turned down because the drug was illegal, and they wrote this long review about how they could get this medication. So you got to really monitor reviews. Remember, when you're responding to reviews, you got HIPAA. So you can't just say, oh, well, you can't say anything crazy. You got to keep it very measured. You can't respond with patient information, but you need to really monitor the reviews, because you can get a lot of reviews, but they could be bad. But make sure that if you do have a good experience with the patient, force that patient to write a good review for you. Say, hey, I'm glad you got a good result. I'm glad you really like this app. Could you write a review? If you see that something is going bad and you see a bad review, call your patient and say, oh my goodness, let's talk about it. How can I do better? How can I do better? How can we resolve the issue? And then ask them to take it down. If they don't take it down, that's fine. But at least you know that you're trying to make a resolution on that review, because patient reviews are huge now.
And they're huge in your search engine ranking. And you bring up a good point. One of the things going to happen, no matter what you do, no matter how great service you provide, the service you provide is all in the eyes of the beholder. And some people are going to write negative reviews. And I'm going to tell you that based on research, you have to have negative reviews on your site. If you don't, consumers don't believe what's being said, because they know no one ever has a perfect day delivering service 365 days a year. It is how you address that and how you talk to them, and that you respond quickly, and that you try and offer ways to make make that poor experience better, or that you at least responded to them versus you went dark because it's like, well, this person hates me, I'm not even going to talk to them. What we try and do is we actually have a very disciplined approach to how we we deal with online reviews, and we try to immediately move them off of a public forum, whether it's on Facebook or it's on Yelp or or any of the online review. Immediately move them into a private space. Get them into an email conversation and move them into your customer recovery group as quickly as you can. But make sure that you're showing on those reviews that you did respond, you did acknowledge that you may not have delivered the level of service someone expected, but you want to understand their issues, and that's better done, offline, because as Doris put it, plenty of HIPAA issues you can run into on that. So if you can just acknowledge there's an issue and try and move them into a non-public space, then you can begin to have deeper conversations.
Right, but make sure you address it on Yelp and Facebook, but just short, like, sorry you had a bad experience. We hope to give you a better experience the next time. Something short, nothing crazy. Don't argue in the comments. It doesn't make sense. And then, as Warren is saying, pick up the phone and call, send them an email, have the private conversation. But the way that you respond is important, because you don't even want it to be a long response. I mean, one time we responded, so sorry for your experience. Hope you have a better time. Sorry you felt like that. And she just kept going. I'm like, oh, okay. Some people are just never going to be happy. Like, they're just not going to be happy. So you just go, okay, well, short, simple, and then move on.
Yeah, you don't want it to escalate. And and there are people who will escalate.
There are people who will on purpose. They'll just
yeah. And by the way, that kind of stuff is not just related to your patients. You will also at some time run into someone who doesn't like one of your employees, that has nothing to do with the service, never came into your building, that may post something negative about one of your employees. Be prepared for those too. And again, you're trying to move them off of a public forum as fast as you can. If you do happen to get someone that comes in and they make a negative claim about you or a negative review, and it's not you, or they didn't come to your facility, which happens, you can reach out to the online review platform and ask them to take that down. That is okay. If they use profanity, if they're not addressing a service issue, go ahead and reach out to the Yelps and the Facebooks and the Google Pluses and ask them, say, hey, I need you to take a look at this and maybe take it down, because this is not reflective of a true engagement with my service.
I think the best part about all of this is that you respond, you, the employee, you respond to it, and then you take the major conversation offline, and not to continue on with whatever it is that they're having an issue with, real or imagined. The point is, take it offline, but acknowledge that they have a concern, because perception is real. And you have to be able to maneuver through that process, and acknowledgement is really good to be able to do that. So I'm excited about that. Does anyone else have any questions or anything else that you guys would like to add? It's been very enlightening to hear this information. I know that there are a lot of organizations that are struggling and trying to figure out, what do I do next? How do I handle this? What do I need to do? What about those companies that see that the end is near and they're going to have to probably close or sell to another practice or sell to a hospital? What are the steps that they would need to take to go through that or process? What do you think? What are your comments?
What are the steps?
Anyone?
What do you say?
I mean, I guess my question is, what is it that they would realize, or when would they realize, we're not going to make it? Is it when the bank down to zero? Is it when the staff all just leave? When the patients never do return? Is it a combination of all of those things, or what is it?
I think if it's your personal business, I think it's a personal choice. I mean, I know with us, when you invest so much into a business, and so much time and so much energy and so much sweat equity, it's very hard to leave. And I think healthcare is going to suffer by having a lot of businesses be run by bigger corporations, right? Because, you know, people like that personal one-on-one doctor-patient relationship, and the doctors need a chance to have an opportunity to make more money. So I really think it's a personal conversation that you need to have with your staff and your family, because I think that as long as you're paying your staff, they'll stay. As long as you're respectful and paying your staff, they'll stay. To get the patients back, you got to reach out to Warren, you got to reach out to your SEO people, because your patients love you. COVID, not COVID. You're a good doctor. You're, you know, being very communicative. They love you. They'll be there. But you've got to be the one to really get in and engage. What I'm finding is a lot of doctors' offices before this weren't really engaging with patients. You know, you make your phone call, you schedule an appointment, and that's it. It's not just that type of business anymore. You are like everybody else. You got to do the constant marketing. You got to constantly be engaged with your patient list. Birthdays, Christmases, you got to really let them know. You got to make them feel like you guys are, you and your patients, you're in a team in the care together, and remind them. I know a lot of patients weren't coming back because they were scared, right? And then they weren't paying attention to their other health ailments, right? Like there's COVID, but there's also heart attacks. There's also aneurysms. There's also all these other things that are happening that you got to be aware of. So, you know, yes, it's unfortunate that, you know, we're in this type of economy, but I don't want any provider to feel like they have to give up. They just have to fight differently. You've really got to be engaged with your patients. You have to say, yeah, you know, you're usually scheduled for appointment, you know, 6 months from now or 4 months from now. What symptoms are you experiencing? Because a lot of people have chronic illnesses that they're just not paying attention to. If you got the tingling in your hand, you got to go to the doctor. Go. I want to share a personal thing, and I don't want to. One of my family members just found out that they have cancer. They only found out because they were having some back pain, and they got an MRI. In the back pain, they saw a tumor growing in their body. This is during COVID. They did not want to go to the doctor, did not have, you know, a reason to go. They just had slight discomfort in their back, and they decided to be proactive and take a look at themselves. And I think that doctors' offices need to be emphasizing to their patients that there are other illnesses that you can die from. Get checked out. So, yeah.
And that's where telehealth comes in. Because, you know, and if you got patients that are scared, talk to them about telehealth, because that's the greatest way in the world to get them to go, hey, just take a look at this and talk to me a little bit. And then you can make a good decision. I mean, an informed decision on whether to bring them in or not. And then you can explain what you're going to do to make it safe for them to come in. And again, that's back to the patient really, you know, getting back to that person-centered care and delivering the care in the way that's best for the patient and keeps them healthy.
Yeah, I just think every industry is going to have to just make a big shift and be very personalized with their patients, their clients, with everybody. It's got to be really personal. You got to understand what's going on in their life and then coordinate the type of care or services that person needs based on what they're experiencing. Because, you know, one thing that people will always pay for is healthcare. You're gonna go to the doctor if your doctor feels that there is an issue. You'll find the money, you know, insurance or not insurance. And hey, maybe you'll say, maybe I need to change my model. Maybe I can't just take all insurances because people are losing their jobs. I got to take some cash pay. People will find the money if they have to have a surgery, if they need to get an exam, because they have to. So capitalize on that.
Creativity, a marketing plan, repurposing, patient-centered. Those are the types of things that we need to start focusing on more so these days. Who knows what the next 4 months of 2020 will bring us? Hopefully something better, but who knows? And we just don't know. I want to thank you guys so much for being here. Doris, DK, and Warren White, we really, really appreciate your presence, your expertise, and your time here with North Texas MGMA. I'd also like to be able to thank our Texas MGMA team for helping us out as well down in Austin, and our North Texas MGMA board. We're excited that we had this opportunity to be here. We're excited for those who listened in, and this is being recorded, so you have the ability to go back and listen to it again. Are there any last words from anyone before we sign off? We want to be respectful of everyone's time. We started at 11:45 and we want to be able to stop at 1. But is there any last words with anyone? Doris and Warren?
No, I again, I appreciate the opportunity, Gretchen and MGMA, and I had a great time, going back and forth with Warren, and this has been really fun, and look forward to doing this again. I love the Zoom.
Yes, yes.
Well, I'd like to reiterate my thanks, to your whole group, the board, everyone listening. Also to Doris, it's been a pleasure working with Doris. And these are the kind of connections I think that create lifelong relationships and working together. And I want to leave you, if nothing else, with we're in a tough time. It's going to get better. We can work through this, and we will, and we're going to come out on the other side stronger with a better healthcare system, delivering better care. And that's what I think we all need to keep that as our focus, because we've got to take care of patients because nobody else is. And I salute all of you for for being great caregivers, being dedicated, and being there for your staff and for your patients. I salute all of you, and I'm honored to have had the chance to speak.
Thank you so much. Thank you again, Warren. Thank you, Doris. Thank you for the opportunity that you've given us to get to know you. I'm excited. I have new friends now, and we're excited about that. So thank you so much for your time. We appreciate you, and enjoy the nice weather that we're having here in Dallas. Thank you so much. All right. All righty. Bye-bye.
Bye-bye.